Imagine this, your cat refuses to eat for just one day. Seems like no big deal, right? Maybe she's just being picky? Perhaps she ate something earlier? But what if I told you that right now, at this very moment, an irreversible process could be starting inside your pet that within days could cost her life? I know this sounds terrifying, but the truth is thousands of cat owners around the world lose their pets every single day because of this. And the scariest part? They had no idea about the danger until it was too late. Today, I'm going to tell you why even one day without food can turn into a deadly threat for your cat. And by the end of this video, you'll know exactly how to recognize the first signs of trouble and what to do to save your pet's life. But first, let me ask you a question. How long can your cat go without eating before you start worrying? 1 day? 2? 3? Remember your answer. Soon you'll understand why it could be fatally wrong. You know what really strikes me? Most people think cats are these independent, self-sufficient creatures. If she wants to eat, she'll eat. If she doesn't, well, no problem. She'll come around when she's hungry, right? Wrong. Absolutely, catastrophically wrong. And here's why. Over millions of years of evolution, nature created the cat as a perfect predator. Every cell in their body is tuned to one single type of nutrition: meat. Constant, regular protein intake. They're not omnivores like us. They can't switch to carbohydrates or plant-based foods when protein is scarce. Their metabolism is a precision-tuned machine that operates by strictly defined rules. And when these rules are broken, when food stops coming in, this machine doesn't just stop. It starts working against the cat itself. Here's what happens inside your pet's body in the very first hours of starvation. The body realizes there's no food, energy is needed, and it does what seems logical. It starts using fat reserves, burning its own fat to get energy. Sounds normal, right? After all, that's exactly what fat exists for in the body, as a backup energy source. But here's the problem. In cats, this process works completely differently than in us or, say, in dogs. When a cat's body starts mobilizing fat reserves, these fats, triglycerides, rush massively into the liver. Imagine a wide river suddenly being forced through the narrow neck of a bottle. A cat's liver is physically unable to process such a volume of fat. It can't break it down fast enough, can't convert it into usable energy. And what happens? Fat starts accumulating directly in the liver cells, in hepatocytes. It's like trying to pour the contents of an entire barrel into a small pitcher. The pitcher will overflow, right? The same thing happens with liver cells. They literally become clogged with fat, swell up, lose their ability to function normally. And this process has a name: hepatic lipidosis, or to put it simply, fatty liver disease. Now let's stop for a second and realize the full seriousness of the situation. The liver isn't just another organ. It's your cat's biochemical factory. It detoxifies poisons, produces blood proteins, participates in digestion, stores vitamins, regulates glucose levels. When the liver starts failing, everything fails. Absolutely everything. And you know what's most insidious about hepatic lipidosis? It doesn't come with a loud warning. It's not like your cat suddenly collapses and you immediately understand, okay, disaster, we need help. No. Lipidosis creeps in quietly, invisibly, disguises itself as ordinary malaise. The first signs are so nonspecific that they're easy to miss, especially if you have an elderly cat or a cat that's not particularly active to begin with. What might you notice at the very beginning? Your cat becomes lethargic, sleeps more, shows less interest in what's happening around her, refuses to play, stops greeting you at the door. But is that necessarily something serious? Maybe she's just tired. Maybe it's hot. Maybe she's not in the mood. Then appetite disappears. But again, cats are known for being picky. Today she eats this food, tomorrow she turns her nose up at it. You think, okay, when she gets hungry, she'll eat. You buy different food, try different flavors, and time passes. The cat starts losing weight. But if she was overweight, and many indoor cats tend to be chubby, You might even be happy. Finally, losing those extra pounds. Signs of dehydration appear. Mucous membranes become dry. Skin loses elasticity. If you gather it into a fold, it doesn't immediately return to its place. But you need to know how to check for these signs. And so a day passes, 2 days, 3, and inside your cat's body, a real catastrophe is unfolding. Imagine what's happening to the liver during these days. Liver cells continue filling with fat. More and more fat. They swell up like balloons. The normal structure of the organ is destroyed. The liver increases in size, becomes loose, fatty, and at some point, it simply stops coping with its functions. That's when signs appear that can no longer be ignored. Jaundice. You notice that your cat's skin takes on a yellowish tint. This is especially noticeable on the ears if they're light-colored. The whites of the eyes turn yellow. The gums turn yellow. This is bilirubin, a bile pigment, accumulating in the blood because the liver can't process it. Vomiting begins. At first rare, then more and more frequent. Sometimes diarrhea appears. The body tries to get rid of toxins somehow, but the liver, the main filter, isn't working. And here one of the most ominous signs appears. Smell from the cat's mouth. Sharp, repulsive, similar to ammonia or the smell of decay. These are toxins that should have been neutralized by the liver, accumulating in the body and poisoning it from within. But even this isn't the worst part. The worst begins when toxins reach the brain. This is called hepatic encephalopathy, and it's truly terrifying to see. Your cat suddenly starts behaving strangely, inappropriately. She may become aggressive for no reason. Or conversely, fall into some kind of stupor, stare at one spot, not respond to your voice, to touch. She may start screaming, just screaming, nonstop, pitifully or piercingly. Wander aimlessly around the apartment, not recognize familiar places, bump into objects. Tremors appear, muscle shaking. The cat starts walking unsteadily, swaying, falling. Seizures may begin. If you see such symptoms, this is a critical situation. This means the brain has already been seriously damaged by toxins. This means the countdown is literally in hours. And now, as I'm explaining all this, you probably have a question. But why can some cats skip a meal and nothing terrible happens, while others end up on the brink of life and death? Excellent question. And the answer to it could save your pet's life. The fact is, not all cats are equally at risk of developing hepatic lipidosis. There are certain categories of animals for whom the danger is many times higher. And here's where you need to pay especially close attention. Check whether your cat falls into one of these groups. Risk group number 1, overweight cats. Obese cats. Yes, those same cute, chubby ones we love so much. Those same well-fed kitties whose photos collect thousands of likes on the internet. Why are they at risk? Because they have more fat reserves. And when the body starts mobilizing them, the liver receives an even more powerful blow than a thin cat's liver. It literally drowns in this flow of fat. Risk group number 2, elderly cats. With age, metabolism slows down. The liver doesn't work as efficiently anymore. The body adapts worse to stress, and what a young cat could handle might be fatal for an elderly one. Risk group number 3, cats with chronic diseases. Diabetes, kidney disease, thyroid problems, chronic infections. Their body is already weakened. Their liver is already working under increased load. And an additional blow in the form of starvation can be the last straw. But you know what? Even a young, healthy, slender cat can be in danger if certain circumstances come together. Let me tell you about triggers. About those situations that can initiate food refusal and, as a consequence, the development of lipidosis. Trigger number 1, stress. And you can't even imagine how sensitive cats are to stress. Moving to a new apartment. For us, it's troublesome, but generally okay. For a cat, it's a catastrophe. Her whole world has been turned upside down. All familiar smells have disappeared. All familiar places, gone. She's lost. And against this stress backdrop, she may completely refuse to eat. A new pet appearing in the house. A dog, another cat, even a hamster. The cat feels a threat to her territory, her status. Gets nervous, hides, and stops eating. Loud renovations. Construction work at the neighbors. Constant noise, vibration. For a sensitive cat, this is torture. And again, food refusal. Guests coming over, a noisy party. Small children who want to squeeze the cat. All this can be stressful, even changing food. Yes, a simple food change, if done abruptly, can cause a picky cat to declare a hunger strike. Trigger number 2, diseases. And this is perhaps even more dangerous because here you get a double blow. Dental problems. Gingivitis, stomatitis, a broken tooth. It hurts the cat to chew. She approaches the bowl, smells the food, but can't eat. And she can't explain to you that her mouth hurts. Gastrointestinal diseases. Gastritis, intestinal inflammation, pancreatitis. The cat feels bad, she's nauseous, her stomach hurts. Naturally, she doesn't want to eat. Kidney disease. Kidney failure causes nausea, accumulation of toxins in the blood. The cat feels terrible. Appetite disappears. Infections. Viral, bacterial. With any infection, the body throws all its resources into fighting the pathogen. Appetite often decreases or disappears completely. And here a vicious circle arises. The cat gets sick. Because of the illness, she stops eating. Because of starvation, lipidosis develops. Lipidosis worsens the general condition. The condition worsens. The cat wants to eat even less, and with each day, the situation gets worse and worse. And now let's talk about time, about how quickly this catastrophe can develop. Remember these numbers. They could save your cat's life. 24 to 36 hours. 1 day, maximum a day and a half. This is when pathological processes in the liver start launching in at-risk cats. Fat starts accumulating in hepatocytes. At this stage, everything can still be stopped. The disease can still be prevented, but only if you start acting right now. 2 to 7 days. This is the critical period. It's in this time frame that most cats who aren't eating develop clinically expressed lipidosis, meaning the disease isn't just starting, it's already really manifesting with symptoms. By the 7th day without food, your cat is already in mortal danger. The liver may be so damaged that even with intensive treatment, chances of recovery significantly decrease. Imagine an hourglass. The sand is falling. Each grain of sand is an hour of your pet's life. And with each hour, there's less sand, fewer chances, less time. And you know what's most tragic? Owners often don't realize the seriousness of the situation until it becomes too late. Day 1. The cat didn't eat. Well, okay, it happens. Day 2. Still not eating. Strange. But maybe she'll eat tomorrow. Day 3. Getting worse. We start worrying, but still think it'll pass on its own. Day 4. The cat clearly feels bad. We decide if it's not better tomorrow, we'll go to the vet. Day 5. We take her to the doctor. And inside the cat's body, there's already a catastrophe. Don't make this mistake. Please. Now let's talk about how veterinarians diagnose lipidosis, because understanding this process will help you realize why it's so important to see a doctor as early as possible. When you bring a cat to the clinic with suspected lipidosis, the first thing the doctor does is a very thorough examination. They check the color of mucous membranes, assess the degree of dehydration, palpate the abdomen to evaluate liver size. But the main diagnostic tool is blood tests, biochemical blood analysis. And here's what the doctor pays attention to first: liver enzymes, ALT, AST, alkaline phosphatase. With lipidosis, their levels rise sharply. This means liver cells are damaged and releasing these enzymes into the blood. Bilirubin. Remember I talked about jaundice? Well, bilirubin is that very pigment that gives skin and mucous membranes a yellow color. With lipidosis, its level in the blood is significantly elevated because the liver can't process it. Albumin. This is a protein produced by the liver. With lipidosis, its level drops. The liver can no longer cope with protein production. The doctor also checks glucose levels, electrolytes, kidney function. Because lipidosis affects the entire body, but blood tests aren't always enough because elevated liver enzymes can occur with different liver diseases, not only lipidosis. So the next step is an abdominal ultrasound, and here's what the doctor sees on ultrasound with lipidosis. The liver is enlarged. Sometimes significantly, its edges protrude beyond the costal arch. The liver parenchyma, that's the organ tissue, looks very bright on the screen. Increased echogenicity, as specialists say. This is because fat reflects ultrasound differently than normal liver tissue. The structure may be heterogeneous, brighter in some places, darker in others. This is because fat accumulates unevenly, but even ultrasound doesn't always give 100% certainty. In controversial cases, when you need to absolutely confirm the diagnosis, they do a liver biopsy. Sounds scary, right? But actually, it's not as traumatic as it seems. Fine needle aspiration biopsy is used. Under ultrasound guidance, to accurately hit the liver, the doctor inserts a thin needle and takes a microscopic piece of tissue. Then this material is examined under a microscope, and if it's lipidosis, the liver cells are literally packed with fat droplets. It's impossible to confuse with anything else. And now the most important question. The question that concerns every owner whose cat has faced this diagnosis. Can lipidosis be cured? And I want you to hear the answer very clearly. Yes, it can. Lipidosis is a reversible condition, but, and this is a very important but, only if treatment is started in time and conducted properly. Let me explain how lipidosis is treated so you understand the scale of the problem and the importance of each stage of therapy. The main goal of treatment is to resume the intake of nutrients into the body. Sounds simple, right? Well, the cat isn't eating. We need to feed her. But here's the problem. A cat with lipidosis doesn't eat at all. Even if you offer her the most delicious treat in the world, she'll refuse. She's nauseous. She feels bad. She has no appetite. Attempts to force feed her, stuff food in her mouth, are not only useless but dangerous. The cat may vomit. Food can get into the airways and cause aspiration pneumonia. And the stress from force feeding will only worsen the situation. So what to do? This is where enteral feeding through a special tube comes to the rescue. It's called an esophagostomy tube, an esophageal feeding tube. Under light anesthesia, the veterinarian makes a small incision on the cat's neck and places a silicone tube directly into the esophagus. The tube is brought outside and secured with a bandage. It looks, of course, unusual, even scary if you're seeing it for the first time. But believe me, this is vitally necessary. Through this tube, the cat receives liquid food directly into the esophagus, in small portions, several times a day, according to a strictly calculated schedule. You can't give a lot right away. This can cause refeeding syndrome, when the body, having starved for a long time, can't cope with the sudden intake of nutrients. They start with small doses, gradually increase, monitor the body's reaction, control electrolyte levels in the blood. At the same time, infusion therapy is conducted. IV fluids. The cat receives solutions to combat dehydration to restore electrolyte balance. Potassium and phosphorus are especially important. Their levels often critically decrease with lipidosis. Medications are prescribed to support the liver, hepatoprotectors. B vitamins, especially B1 and B12. Vitamin K because the liver participates in blood clotting, and with its damage, problems can arise. Antioxidants. If there's nausea, antiemetic drugs. If there's an infection, antibiotics. Each case is individual, and most importantly, time. Treating lipidosis isn't a quick story. This isn't a situation where you give a miracle shot and in 3 days the cat is healthy. No. Treatment can take from several weeks to 2 months, and all this time, constant monitoring is required. Regular blood tests, weight control, observation of general condition. Patience is needed, a lot of patience. From both doctors and owners, you need to strictly follow the feeding schedule through the tube, monitor the bandage, come for checkups on time. But if everything is done correctly, if you don't give up, if you fight, the prognosis in most cases is favorable. The liver is a unique organ. It's capable of recovery. Fat gradually leaves the liver cells. They start functioning normally again. The liver decreases to normal size. Blood tests return to normal. The cat gradually returns to life. But you know what's better than even the most successful treatment? Prevention. Preventing the development of lipidosis. And right now I'm going to give you specific, practical recommendations that can save your cat's life. Rule number 1. The golden rule. Remember it. Write it down somewhere visible. Don't let your cat go without eating for more than 24 hours. 24 hours is the maximum. The absolute maximum. If a day has passed and the cat still hasn't eaten, this is a reason to see a veterinarian. Not, let's wait another day. Not, maybe she'll eat tomorrow. No. 24 hours. And you go to the clinic, especially if your cat is in a risk group, overweight, elderly, with chronic diseases. For them, the countdown is literally in hours. Rule number 2. Provide regular and balanced nutrition. Cats are creatures of habit. They love routine. Feed them at the same time every day. This creates a sense of stability and security. Use quality food. Doesn't matter if it's dry or wet, yet the main thing is that it's balanced in composition. Cats need high protein content, taurine, arachidonic acid. These are essential substances for them. If you decide to change food, do it gradually, not abruptly. Over 7 to 10 days, mix the new food with the old, gradually increasing its proportion. A sudden food change can provoke food refusal in a picky cat. Rule number 3. Control weight. Obesity isn't just a cosmetic problem. It's one of the main risk factors for developing lipidosis. An overweight cat is a cat at risk. Regularly weigh your cat. Once a month is a good interval. Record the indicators. If you notice weight gain, adjust the diet. Don't overfeed. Don't give in to pitiful looks and meowing. Cats are excellent manipulators. They know how to beg for food in a way that's impossible to resist. But your love for your pet should manifest not in an extra portion of food, but in caring for their health. Rule number 4. Minimize stress. Remember I talked about stress triggers? Moving, a new pet, renovations. Of course, you can't always avoid these. Life is life. But you can soften the consequences. If a move is coming, take your cat's things with you. Her bedding, bowls, toys. Familiar smells will help her adapt to the new place. Set up a cozy corner for her where she can hide and feel safe. If a new pet is appearing, introduce them gradually. Don't throw them into one room right away. Let them first get used to each other's smells. Then onto presence through a closed door. And only then, a personal meeting under your supervision. If renovations are happening, if possible, isolate the cat in a quiet room, away from noise. Provide her with everything necessary: food, water, litter box, a place to sleep. Rule number 5. Be attentive to dental and oral health. This is often overlooked, but dental problems are one of the frequent causes of food refusal. It hurts the cat to chew, she doesn't eat. Regularly examine your cat's mouth. Pay attention to reddened gums, plaque on teeth, bad breath. These are all signs of problems if your cat allows it. Brush your teeth with a special brush and toothpaste for cats, or use special treats and toys for teeth cleaning. And don't skip preventive checkups at the vet. Once a year is the minimum. The doctor will check the condition of teeth and notice problems in time. And now let's talk about a very dangerous misconception. About a myth that unfortunately still exists. The myth about the benefits of fasting days for cats. Perhaps you've heard this recommendation somewhere, that it's supposedly beneficial to give your cat a day without food, for cleansing the body, for resting the digestive system, like fasting for people. Forget it immediately. Throw it out of your head. This isn't just useless, it's deadly dangerous. Cats are not people. Their metabolism works completely differently. Humans in the process of evolution learned to survive periods of hunger. Our body can switch to different energy sources, can gradually, controllably use fat reserves, can enter ketosis mode and use ketone bodies to feed the brain. Cats don't have such mechanisms. Their body is not adapted to fasting, even short-term. As I've already explained, in the absence of food, fat massively enters the liver. The liver can't cope. Lipidosis develops. There's no benefit from fasting for a cat. No cleansing, no rest, only harm, only risk. If someone recommends you give your cat a fasting day, or run from that person. This is ignorance. This is a danger to your pet's life. The same applies to attempts to put a cat on a diet for weight loss through drastic food restriction. You can't do that. You can't drastically reduce portions. You can't skip feedings. If your cat suffers from obesity and needs to lose weight, this needs to be done slowly, gradually, under veterinary supervision. Weight loss should be smooth, no more than 1 to 2% of body weight per week. Remember, for a cat, fasting is not treatment. It's a direct path to disease. So, what should you do if your cat suddenly stops eating? Let's create a clear action plan. Step 1. Assess the situation. Did the cat not touch food at all, or ate less than usual? This is important. If the cat is simply eating less but still eating, that's one situation. Maybe she just doesn't like the food, or she ate something earlier, or it's hot outside and appetite decreased. But if the cat isn't eating at all, doesn't even approach the bowl, this is already an alarm signal. Step 2. Check general condition. How is the cat behaving? Active, playing, or lethargic, apathetic? Is there vomiting, diarrhea, discharge from eyes or nose? Check the gums. They should be moist and pink. If dry, pale, or conversely bright red, this is a bad sign. Gently gather the skin on the withers into a fold and release. It should immediately return to its place. If a fold remains, a sign of dehydration. Step 3. Try to stimulate appetite, but only if the general condition is normal. Warm up wet food. Warm food smells stronger and may be more attractive to the cat. Offer something especially tasty, a favorite treat, a piece of boiled chicken or fish. Change the bowl. Sometimes cats don't like the smell of a plastic bowl. Try ceramic or metal. Put the bowl in a different place, in a quieter, more secluded spot, where the cat feels safe. But, and this is critically important, if these simple measures don't help within a few hours, don't continue experimenting. Move to the next step. Step 4. Contact a veterinarian. If 24 hours have passed and the cat still hasn't eaten, urgently to the clinic. Don't delay. If the cat not only isn't eating but is also showing other symptoms, lethargy, vomiting, diarrhea, don't wait 24 hours. Take her immediately. If the cat is in a risk group, overweight, elderly, with chronic diseases, don't wait either. Better safe than sorry. Don't try to treat the cat yourself. Don't force water or food into her. Don't give human medications. You can only cause harm. The veterinarian will conduct an examination, order tests, identify the cause of food refusal, and start treatment if necessary. Remember, early visit to the doctor is the key to successful treatment. The earlier therapy begins, the higher the chances of complete recovery. You know, I understand that everything I've told you today may sound frightening. It may seem that cats are these incredibly fragile creatures that can die from any little thing. But that's not true. Cats are amazing animals, strong, resilient. They just have their peculiarities, their own biology. And we, as responsible owners, must know and account for these peculiarities. Hepatic lipidosis is a serious, potentially fatal disease. But it's not the most common. Most cats live long, healthy lives, never encountering this problem. But the probability exists. The risk is real. And knowledge is power. Knowledge is what allows you to notice danger in time, react in time, save your beloved pet's life. I've seen too many cases where owners brought a cat to the vet too late, when jaundice had already developed, when neurological symptoms had already begun, and then chances of saving the cat drop sharply. Treatment becomes more difficult, longer, more expensive, and not always successful, but I've also seen many recovery stories. Cats who were literally pulled from the brink, who, thanks to timely treatment, care from doctors, and love from owners, completely recovered. And the difference between tragedy and a happy ending often comes down to one thing: time. How quickly the owner noticed the problem and sought help. Let me once more briefly repeat the key points you must remember. 1. Cats cannot fast. Even one day without food for an at-risk cat can trigger the development of hepatic lipidosis. 2. Risk groups are overweight cats, elderly cats, cats with chronic diseases, as well as cats under stress. 3. The first signs of lipidosis are nonspecific: lethargy, food refusal, weight loss. Later, jaundice, vomiting, neurological symptoms appear. 4. The critical period is from 24 hours to 7 days of fasting. The longer the cat doesn't eat, the higher the risk and the worse the prognosis. 5. Lipidosis is diagnosed with blood tests and ultrasound. Sometimes liver biopsy is required. 6. Lipidosis is curable, but treatment is lengthy and requires enteral feeding through a tube, infusion therapy, hepatoprotectors, and constant monitoring. 7. Prevention is regular feeding, weight control, stress minimization, and immediate veterinary consultation for food refusal. 8. Fasting days and starvation for cats is a deadly, dangerous myth. Never, ever intentionally deprive a cat of food. 9. If a cat doesn't eat for 24 hours, this is a reason to see a doctor. Don't wait. Act. I want to end this video not with a scary story, but with hope. Yes, hepatic lipidosis is serious. Yes, it can be fatal, but it's also a disease that can be prevented and cured if you start in time. Your attentiveness, your love for your pet, your readiness to notice changes in their behavior, this is that first line of defense that can save a life. You know your cat better than anyone. You see her every day. You notice the slightest changes in her behavior, in her habits. And if something's wrong, if your cat suddenly stopped eating, became lethargic, her behavior changed, don't ignore it. Don't wait for it to pass on its own. Trust your intuition and contact a specialist. Veterinarians aren't enemies you're afraid to visit. They're allies in caring for your pet. Their job is to help, diagnose, cure, and the earlier you contact them, the more they can do. Your cat's health is in your hands. Her life is in your hands. And now, after this video, you have knowledge. Knowledge about how to protect your beloved pet from this insidious disease. Use this knowledge. Be attentive. Be vigilant. Be ready to act. And may your cat live a long, happy, healthy life by your side. If this video was useful to you, if you learned something new that can help you care for your cat, please hit the like button. This will help the algorithm show this video to other cat owners whose pets' lives this information might also save. Subscribe to the channel and be sure to click the bell so you don't miss new videos about your pet's health and well-being. There are many more important topics ahead that we'll definitely discuss. And in the comments, share, have you encountered a similar problem with your cat? How did you notice something was wrong? What did you do? Your story could help someone else. Take care of your pets. Love them. Be attentive to them. See you in the next video.